brain is gone. Good evening, everybody. Sleep is a very important aspect of our life. 1/3 of our life we spend on sleep. Unfortunately, in spite of so much on sleep coming up, we still don't have enough science, knowledge and awareness on this area. Today is the World Sleep Day. I think a very important day for everybody. I am Dr. Nageshwar Reddy. I am a gastroenterologist and chairman of AIG Hospital. At the AIG Hospital, we thought we'll have a very special symposium on the sleep day. We have with us a very eminent panel who are going to discuss various aspects of sleep, because sleep affects every part of the body. Starting on my right is Dr. Vishwanath, who is the head of the Pulmonology department, who does a lot of work on the sleep area because it's related to lungs. Dr. Narasimham is the chairman of Cardiology, and also he is a specialized electrophysiology. Again, huge amount of work in sleep area, and I think we'll try and see what is the correlation between cardiac problems and sleep. On my left is Dr. Srinivas Kishore, head of department of the ENT. In fact, he is also, I think, the president of the Indian Sleep Society.
Immediate past president.
Immediate past president, and he again has huge interest, has recently in fact visited the Stanford Sleep Lab, which is one of the best labs in the world, and is passionate about sleep disorders. To his left is Dr. Varunidhi, who is a psychologist who actually runs a psychology center, Interconnect, and she also advises for NALSA Law School. So she has a very impressive credentials. And finally, we have somebody who is not a doctor here, who is a airline pilot with Air India Express. Anvish is very important for us because all of us are flying every day. Today, immediately after this program, 2 of us are flying. So we wanted to be very safe and hope that sleep is an important factor in pilots. So we decided to have him on our show. So we'll start first with probably the most important organ in our body, the heart. We'll ask Dr. Narasimham, what is the correlation between sleep and heart, and what are the various factors that can affect it?
Thank you very much. And thank you for the kind invitation. Sleep has been ignored as one of the risk factors for cardiovascular disease for several decades. But increasingly, patients with cardiovascular disease, heart failure, patients with arrhythmias, patients with cardiovascular disease, in all of them, adequate and restful sleep improves the outcome of these patients. It's been quantified that anywhere from 30 to 60% of these patients will have a significant improvement in their arrhythmias or heart failure if you correct the underlying sleep disorder. And having said that, it needs a very intensive multidisciplinary team to understand this. And there are a lot of outcome studies which have emphasized improvement in cardiovascular outcomes after correcting the sleep disordered breathing.
Thank you, doctors. In fact, I was always confused because a hospital sleep lab is mostly occupied by cardiovascular patients. Cardiologists send them, so I was wondering what is the connection. But you very clearly explained to us that there is a definite, I think a very important connection. We'll actually now ask Dr. Vishwanath, what are the different types of sleep apnea, and what is this term sleep apnea? I think the public should know what it means and what are the different types of sleep apnea.
So there are numerous types of sleep disorders, and one of the most common type of sleep disorder is sleep apnea, in which you have disordered breathing or dysfunctional breathing. This condition, sleep apnea, is also called as sleep disordered breathing. because during sleep you're not able to take enough amount of breath, because of which your oxygen levels drop down during the sleep actually. So there are two types of sleep apneas. One type of sleep apnea in which there is obstruction either in the nose, either in the mouth because of your large tongue, or because of like impaired dentition, and sometimes it can be because of obstruction at the throat level. People who have a lot of fat accumulation around the throat have obstructed throat, as a result of which enough amount of air will not be able to go into the respiratory system. So this kind of sleep apnea where there is some amount of obstruction either in the nose, oral cavity or throat is called as an obstructive sleep apnea. And sometimes there is one more problem which is called as an central sleep apnea. So we all require some signal from the brain to the respiratory system to breathe effectively. So sometimes this signal which is coming from the brain is totally cut down. As a result, we will not be able to breathe properly. This is called as an central sleep apnea. This kind of central sleep apnea where your brain is not functioning well will happen in patients who have neurological conditions like stroke, Parkinsonism, and if the patient has a congestive heart failure like Dr. Narasimhan mentioned actually, those people also have this central kind of sleep apnea. Lot of times people with sleep apnea are not aware that they have sleep apnea. In fact, lot of people who have snoring think that they have a deep, good quality sleep actually. And we should all remember that snoring is not a sign of good sleep, and snoring is because of disordered or dysfunctional breathing because of some obstruction somewhere in the respiratory passage.
Thank you, Vishnu. In fact, I think this is a very important point about snoring. The person who is snoring doesn't know, but his wife or whoever his partner is knows that he is snoring, and that this can create a problem, I think. And then there's sudden apnea during snoring, which actually disturbs the partner also very much. So, Srinivas, I think you are an expert in this ENT area. Vishwanath told us about obstructive sleep apnea. What's this obstructive sleep apnea?
So basically, whenever you're talking about sleep apnea, that is actually inability to breathe, which is apnea during sleep. So that is called as sleep apnea. So when you add obstruction to it, so there is obstruction to the free flow of air during sleep, causing the patient or an individual the problem of apnea, that is inability to breathe. So the obstructions can happen anywhere between right from the nose, because the airway extends right from the nose up to the lungs. Now the obstructions can be constant static obstructions, or they can be dynamic obstructions that are only coming to play during sleep. So what is very important for us is to evaluate as to how much air is going in or not going in, which this sleep study will tell us, which is the first step in terms of evaluation of this condition. The next step is actually what is causing the problem. Is it a obstruction in the upper airway which is going and coming only when the person is asleep, or is it persistent throughout the day? So based on this evaluation of the severity of the problem and what is causing it, we come to a diagnosis and start treating this condition.
So, Srinivas, this is a common complaint. People also tell us that he is okay normally when somebody is sleeping. These are wives complaining usually. But when he takes an alcoholic drink, he starts having a snore. Why is that? Why does alcohol produce some sort of an obstruction?
It's a very nice question, sir. I think a lot of people even take alcohol as a sleep aid, and I'm sure Varu can explain a little more about that. But that's the worst thing to do, because alcohol as a drug works at both levels. One, it sort of numbs your brain to trigger a breathing, and number two, it also causes enormous amount of relaxation of the upper airway muscles, and that causes the airway to become smaller and hence more make it difficult for the patient to breathe. So it also sort of works, as we are going in the discussion, we'll come to the discussion where the sleep is of two kinds, the dream sleep and a non-dream sleep. So it works, so every person's sleep should have an ideal amount of non-dream sleep and dream sleep. So when alcohol comes into that mix, it destroys the delicate architecture, also making it difficult for the patient. So alcohol as the sleep aid is one of the worst things anybody can do to themselves.
Yeah, so this is an interesting point. So let's come a little into this discussion, because in lay public and whenever you're discussing, in even papers come up about this ideal sleep time. People
Right.
say you require 7 hours, some people say 8 hours, some people say no, I'm sleeping 4 hours, that's enough for me. What is ideal sleep time? Is there ideal sleep time? And you're also talking about different REM sleep, non-REM
Yes.
sleep. Can you explain a little on this, because it's
Yes.
interesting.
So basically, sleep is not a luxury, sleep is a necessity.
Yeah.
So as we all know that sleep is a necessity, that means evolution has made it, there is a purpose for it. So a lot of us know that there is memory consolidation, there is physical relaxation and mental relaxation happening during sleep. Now, sleep, for that matter, the moment we are born, the kids actually can go into dream sleep just like that. Whereas for adults, what happens is there is a particular algorithm that we need to follow. There is dream sleep and there is non-dream sleep. Non-dream sleep is divided into stage 1, 2 and 3, and then one goes into dream sleep. So most of the students would know that when there is a boring lecture happening, or most of the conferences, if there is a boring talk going, most of us going to stage 1 of sleep. Some people have the amazing capability to go into second stage of sleep, but that's a different matter. The fact of the matter is that we need to have an ideal amount of non-dream sleep and dream sleep. Now, for a small baby who's just born into this world, they keep, and you would see in your families as well, the babies are sleeping throughout, because that's how their brain is maturing. And as you keep growing older and older, a baby who's sleeping about 16 to 20 hours a day is slowly sleeping lesser and lesser and lesser. And by the time the person is 6 to 7 to 8 years old, even though they do require an afternoon nap, and that's why most of the kindergarten have afternoon nap time as well. So by the time you are about 7 to 8 years old, slowly that cycle sort of matures and the sleep cycle gets into an adult form of sleep until adolescence. Once there is adolescence, again there are hormonal changes that cause a little bit of changes in the very delicate sleep harmony. So for every human being, sir, as an adult, you should have about 7 hours of sleep. And the more you do not or deprive the body of that sleep, that is called as sleep debt. So it's like a credit card that you are swiping.
So you don't sleep on a normal days for say 7 hours, you're sleeping only 4 hours. Can you make it up one big sleep on a Sunday?
So they say there's weekend catch up
Yeah, is
sleep.
that there?
So there is this concept called weekend catch up. It works for person to person, but every day, the days that you are not sleeping well, you are accumulating that debt which can hit you over the weekend. So if you compensate over the weekend, will it be completely equal as to sleeping 7 days a week? Exactly, not really. But something is better than nothing, so you can manage to do that.
That's not ideal, but
That's
if
not
you can't.
ideal,
Okay.
but yes,
Yeah,
it can
because
be done.
in this busy life, sometimes people
We
don't
tend
get
to,
there.
yeah.
So we'll go to Varadhini, because there's a lot of discussion about how sleep can affect your performance, mental performance, physical performance, and so on, and that it's other way around also. If you're depressed, if you're mentally not sound, you don't sleep well. So what is this complex relationship? Can you explain between?
Thank you for the opportunity, and it was really nice to hear all the physiological effects of sleep. And I'll spend some time and talk a little bit about how sleep affects mental health. And people, whenever a client comes to me, the first thing I ask them is, are you sleeping well? Because that tells me whether their mind is rested or not. It is so, so important. Sleep deprivation has a direct impact for people with depression, anxiety, irritability, all of these things. And adding to that, sleep indicates also severe mental illnesses such as bipolar or schizophrenia. So sleep cannot be underestimated, the importance of it for your mental health. It affects your mental cognition, your mood, how well you're able to function during the day, whether you're able to be present for family members or not. There's so much that's related to sleep. And one of the first things we do in the center, or when I have a client and I know that there's sleep deprivation, the first thing, even therapy doesn't work. People think, okay, go and talk to the person, but the person's not sleeping. I can't. There's nothing the person will take even from therapy. So the first thing we need to do is correct the sleep, correct the nutrition, and the third pillar is physical movement. These three things are tenets of mental health. If we get those right, then therapy or adding anything else on top of that, the body starts to be able to pick up. And
what about all the sleep tablets? A lot of people take tablets.
Yes.
So is that good, or you think it's?
I think it really depends on case by case.
Yeah.
If we have a client who has severe sleep deprivation, we do send them to Dr. Srinivas or
I mean, there's some cause, anatomical cause. But suppose doesn't have any cause, it just says I can't sleep for some reason.
So
this is a very common problem.
common.
I get a lot of people say I can't sleep, whatever
Absolutely.
I do. So what would you then do?
So the first thing is sleep hygiene.
Okay.
We
What
start
is that?
looking at the sleep hygiene. Like what time are they normally going to bed? What time are they getting up? Do they have disturbed sleep? What are they doing 1 hour prior to sleeping? What do they do after they get up? What does their day look like? All of these things will help us to understand how is the person's lifestyle affecting their sleep quality. And so adding to this, the sleep hygiene, educating them. So depression, one of the first things about depression is you either sleep too much or you don't sleep. And another common thing, which is you don't need to be diagnosed with anxiety. Everybody worries. Everybody worries. Who does not worry? And the normal time that people worry is at night. When you're left alone, you're in bed, and you're thinking about it. And then you start worrying about, oh, I didn't get this done. I need to get this done. About the future, about the past. And that worry stimulates the brain that it does not allow you to sleep. And that affects your sleep. And if your cortisol levels are high, you are going to have disturbed sleep. You will get up around 3 o'clock, and we call it the high cortisol, like 3 o'clock. If any of you get up at 3 o'clock, have a look, and if you're worried, that's an indicator that your stress hormone is high, and that's why you're not sleeping well. So there is a lot that we do by just asking a person how their sleep hygiene
It's all
is.
questionnaire. This is the biggest problem in sleep. We don't have an objective evidence. I have people who come and tell me, I follow everything, I switch off the light, I don't see the TV, I don't see my smartphone, I don't see the laptop, but not getting sleep till morning. And then for us in physiological sense, we always measure something in hormones or something to say this, but we can't do anything in sleep. I don't have an answer for that.
So there is what we call as a psychological phobia related to sleep. So when someone keeps fearing that, oh, I'm not sleeping enough, I'm just not, I keep getting up at 3 o'clock, I keep getting up at 1 o'clock, sleep is such a touchy thing for the brain. Like the more you concentrate on it, the more evasive it gets.
So maybe in later part of the discussion we'll come to Yogi Nidra and all. Vishwanath can explain because he does that. So before that, it's very important. All of us fly. Whenever I take a flight, I get worried. Did this pilot get enough sleep before he Anmish, what exactly does the airline do to see that you get enough sleep before you take off a flight?
Thank you for the opportunity, sir. Sir, like whenever we talk about the rest periods, the Director General Civil Aviation, which basically governs the airlines or flying or how it is. So they have a set pattern which is called flight duty time limitations.
Flight duty time?
Limitation.
Which
is we call as FDTL. So every airline or every private operator, whoever is it, they have to stick to those guidelines. So the airline gives you a roster according to that. So it's again the individual pilot's responsibility that he should take adequate rest. Most of the people, as ma'am said, they think about sleeping, but
so they gave you 8 hours off to sleep, but if you go and party of those 8 hours, you can still take the flight. There's no way of determining whether you slept or not. No,
there is no interpretation like that, sir. It's again we have to self-certify.
And so they don't do any tests or anything like any psychometric tests they do?
They
before you take the
do
flight?
it,
Every
sir.
time or once in a
No,
while?
it's during the induction time they do it.
Oh, that's all. Afterwards
So
they don't.
every time before the flight, they do a breath analyzer test.
That is
So-
for alcohol part.
Yes.
But for sleep, we don't have any way to
No.
test.
It's
But-
again the doctor who is doing the breath analyzer. He examines the physical attire, and then if there is something wrong, then he
then
points
they-
it out.
So there are always two pilots for every flight. Is it because of this thing to avoid one pilot, something happens like that?
No,
or-
no, not really, sir. So each individual pilot has their own responsibility. As again, one guy has to monitor the other. He may not be right always. Sometimes there are errors such that you do it involuntarily.
Okay.
So the other guy has to monitor. It's both. The responsibility lies with both.
So both. No, because we are in the sleep context. Has it ever happened? This inside information. You may not want to give it, but has it ever happened that a pilot falls asleep and the plane has a problem?
I would not term it the plane has a problem.
I mean, the people in the plane have a problem. Then.
Yes. There are several incidents that initially one pilot falls asleep and subsequently the other guy also falls asleep. There are several incidents where they just plane went to the destination and then it kept holding.
It goes to wrong destination or something. Like
It goes to the destination as planned, but the aircraft doesn't know what to do next till the time you give the command. So there are incidents like that. So there are, legally you can still sleep if it's called as control rest.
What is that?
It's called control rest.
Control rest.
So whenever you're in the cruise, when both the pilots are awake, one guy can take the control rest for a period of 30 minutes. So that 30 minutes is given because of so many medical reasons, saying that if you sleep beyond 30 minutes, that your brain goes into the deep sleep and the ability to perform your duties after that may not be accurate. So there is something called as circadian rhythm, which
circadian
most of
rhythm.
the people are aware.
Yeah, but you don't have circadian rhythm. You're flying night, you're flying morning.
Yes.
So that gets affected.
That's the major challenge what
major
we
challenge.
face. So every duty is at a different time. So what affects us more is there's something called as circadian low, which we term it as window of circadian low, WOCL. So it's basically from 2 o'clock in the morning to 6 o'clock in the morning, where the ability to perform any task is at low.
2 o'clock in the morning to?
6 o'clock in the morning.
Oh, those 4 hours is correct.
That 4 hours. So here your
So we
concentration.
should not take a flight at that time also. All of us. But that's the most often flights that go off.
Yeah,
in
all the
place.
international.
Yeah.
All the international, all the domestic, in fact, they start in the morning, 5 o'clock. So that affects us more, sir. The fatigue, what we are talking, like the doctor said.
Yeah.
So there is another fatigue called circadian fatigue, which actually affects a lot of people. For the pilots as well. So there is no understanding of oneself that, I'm having a sleep deprivation or something like that. So that orientation is not there for most of the pilots.
So
as well.
the pilots have taught some classes how to sleep and things like that. Nothing.
No, nothing as
formally.
such.
I
There
think
is something called as human factors. There's a subject altogether.
Oh, you have.
So it's basically a self-study. So
What I don't understand is sometimes now these cars and all are having a beeper. Suppose the driver falls asleep, immediately it wakes you up. Do plane cabins have those?
we don't have anything of
So why
such
can't they
kind,
put
sir.
in? Because there are now good AI tools which can sense whether the pilot is sleeping
Yeah.
and immediately wake him up.
There is an SOP designed for that, so that even if the pilot falls asleep, somebody has to alert them.
No, but instead
So
if automatically AI, artificial intelligence doing it, then it becomes very safe.
Not necessarily, sir, because there is a cabin crew in the cabin.
Yeah.
So it is her responsibility to call you every half an hour in the night.
Oh, they call.
They call. So they call, wake you up, and then assure, okay, everything is fine.
Yeah, so we see them very often going and serving some coffee. We are grumbling that why they're being looked after so well, but now I understand why that is. Yeah.
It's their responsibility to keep us awake as well.
Yeah. So thank you, Anvish, for giving us so much insight into things that we don't understand. We'll come back to the medical part. We'll ask Dr. Narasimham regarding so many cardiac problems like arrhythmias and all related to sleep and sleep apneas and all. How effective is treating this? Can you treat your patients completely just by treating these disorders?
Yes. Yes and no, because this may be a part of a multi-system disorder. A person is obese, person has hypertension, diabetes, and he also has a sleep disorder. So we have corrected only one aspect of the problem. There are some patients who have, like recently we had a patient with a 8 to 9 second pause and a faint, and he came for a pacemaker. We diagnosed him to have a sleep apnea. Once that was corrected, Srinivas Kishore operated. It's completely gone. There's no indication for a pacemaker. So younger patients without comorbidities who don't have diabetes, hypertension or other heart disease, sleep by itself can cause arrhythmias, which are completely reversible once you correct this problem.
Correct. So nothing else, no drugs are required, just
No.
correcting the
In
problem.
fact, paradoxically, these patients have a higher tendency to faint because the melatonin that gets secreted, everything is reversed. So they have a heightened sympathetic tone throughout the day.
Yeah.
So they are also more prone to develop vasovagal syncope, faints. So if you correct the sleep apnea, the incidence of faints come down.
So, Vishwanath, you want to add?
One of the reasons for increased sympathetic activity is also because these people, because they are sleep deprived and fatigued all throughout the day, they try to take more caffeine, tea, and then they try to smoke so that they keep themselves awake actually, which is a thing which can activate them. But that is not a good way of activating. That is also one of the reasons.
So,
of
keeping
increased
awake using all these artificial methods are not good.
Yeah.
I think we have to blame the doctors also, because many of us, you have to do surgeries late in the night or emergencies, you have to keep awake, you start drinking coffee and things like that. So it's very dangerous, you are saying.
Like, to a certain extent it's okay, but you should understand that if you're taking too much of caffeine, it means that is a sign of sleep deprivation, and then try to correct the sleep duration.
But what about CPAPs and all? Maybe you should explain. Public really don't know about this. There's a lot of resistance when you get a report of sleep. But before that, maybe you want to talk to us about how sleep testing is done. You have a sleep lab. It's called a sleep lab, and sleep is tested briefly in a layman's term.
Yes, sir. Actually, it's a very important question. As has been discussed now, we have two types of apneas in which you are not able to breathe well actually. The obstructive sleep apnea and the central sleep apnea, where you are not getting enough signal from the brain actually. So to check all these things, what we do is we check the breathing pattern, like oxygen saturation, and then we check the movements of the chest and the abdomen, which are the main muscles of breathing actually. The abdomen and chest have got muscles for breathing actually, whether they're moving well or not, the diaphragmatic movements. And then Dr. Srinivas also mentioned about dream sleep and non-dream sleep. So this can be captured by putting some electrodes to your scalp region. So it tells us how much you have a non-dream sleep and how much you have a dream sleep actually. All these things are captured in using different sensors which are put on your body actually. So, and again, depending upon the complexity of the problem, some patients require in-hospital sleep study where all these electrodes and leads are kept actually. But however, in large segment of population, which have this central, the obstructive sleep apnea, where you have blockage in the throat or in the nose or any of these things, which is called as an obstructive sleep apnea. So you can do an home sleep study with lesser parameters and lesser electrodes actually. So most people find the home sleep study to be more comfortable because that allows them to sleep in the comfort of their own home, and then they'll be able to fall asleep. Some people require complex sleep studies, especially patients with cardiac conditions, patients who are already on oxygen or chronic respiratory conditions. These are the patients in which your doctor might suggest you to go for an sleep study in the hospital, which is called as a level 1 sleep study. So this is in brief about the sleep study.
Yeah, so you have sophisticated sleep labs now, and you can do different levels of sleep depending upon the need, sleep studies. That's
Yes,
very
sir.
important. I think public should know that you can. So which means that would you recommend that anybody who's snoring should get a sleep study done?
So
Or significant snoring, I mean.
if they have snoring and then their partner has witnessed some apneas or breathing stopping of
Or is disturbing the partner for any reason, then you should
stopping
go.
disturbing the partner, and then they're also having unrefreshing sleep. When they wake up in the morning, they're not feeling fresh,
feeling
or
tired.
when they're falling
So
asleep or
it's-
tired during the daytime, fatigued. All these things are signs of
So now
sleep
we
apnea.
have the ability to test this very carefully in sleep labs.
Yes,
I
sir,
think
and
that's
some-
very important for the public.
And other times they may not have any symptoms actually. They may not snore, but sometimes they may have uncontrolled hypertension, uncontrolled diabetes. There are certain conditions actually which the doctor might say that you might be having sleep apnea and suggest you for a sleep apnea. Most of the times we hear from the patients that, doctor, I don't snore at night time, my sleep quality is good. Most of the patients who come from Dr. Narasimhan say that I sleep well.
Yeah. But
I have a
actually
deep
they are
sleep
not,
and
they are
everything.
not, they don't
so
know
it all
that.
depends upon the physician also. There's suspicion actually with the systemic condition.
So can we now with all these cell phones and all smartphones record whether you're sleeping or not? Because we have watches, rings, so many wearable devices. People are able to, are they accurate? A ring or a watch to say how, any
so it
idea
gives
about
us like
Brief
a gross idea about the
Okay.
sleep actually.
It's not very
Like,
accurate. It's like
yeah.
below the sleep lab level.
Yeah, below
sleep
the
lab
sleep
is the
lab.
best way, but if you don't, or you can have this as a some warning that something. So that's Srinivas, a lot of patients. So after they finish the sleep lab, they've seen Vishwanath. They come to you saying that there's some snoring and all. How do you approach this?
So basically, once there is a diagnosis of an obstructive apnea, whether it depends on whether it's a child or is an adolescent or an adult or an elderly. So each one, there are certain target sites where their obstructions could happen, sir. Now, most of the times, like I said before, the obstructions can be constant. That means they are prevalent throughout the day and in the night as well. Now, there are some obstructions that are there only during the sleep. So, in order to identify that, because there is no other way to pick it up except in their sleep. Now, we can't secretly go into people's bedrooms with a scope and try to look into which looks very bad. And it's also very difficult to do natural sleep endoscopies. We do what is called as a drug-induced sleep. So, it's a drug-induced sleep wherein we try to bring them as close as possible using different techniques, let them go into sleep, let them go to the same level of sleep that they got in the natural sleep in the sleep study. And once they get into that, we use very small cameras like endoscopes to go into through their nose and evaluate the level of obstruction and the structures and severity of obstruction. Once we evaluate that, then we know, and during the same test, we actually try to put in different treatment modalities to see, okay, what is the best technique that is helping this patient? Is a CPAP helping this patient well? Or there are certain devices that you put in the mouth called mandibular advancing devices. Is that helping the patient? Or bypassing the airway through any kind of a surgical intervention by putting certain tubes that can bypass the upper airway, is that opening up the upper airway to make the patient breathe better?
So, Srinivas, I heard there's a small surgery nowadays. You can implant something in your muscle there, and that will. What is that?
So, because most of the cases, what happens is since the airway is collapsing, there is a mismatch between the dilators of the upper airway and the factors that are collapsing the upper airway. Now, the largest dilator of the upper airway is the tongue muscle. So, the tongue muscle is supplied by one of the cranial nerves called the 12th nerve. So, what we do nowadays, and there is now almost 10 years all around the world, there are very good results coming from it. You normally, how Dr. Narasimhan paces the heart, we pace that particular nerve. And it is, the receptor for it is put in the chest. So every time the person is inhaling, the lead actually detects that the person is breathing and sends a signal to that nerve. So once the nerve is given or paced, it just brings the tongue forward so that the airway generally opens up and the person can breathe. So it's got a nice program. So it's not on all the time. The person basically switches it on when he goes to sleep, and the moment it goes to a person goes to sleep, it automatically starts kicking in, and the person.
So I think that's very interesting to know that there is a device for heavy snorers.
Yes.
You can't operate it. This is a very good idea, and we're starting to get a lot of questions online also. We won't be able to answer everything because of the time limit, but one interesting question we'll ask Vardhini to answer is that there's this patient, there's a person called Praveen Dutt, and he says he's suffering from sleep deprivation because every 1.5 hours, 2 hours he gets up and then he can't immediately go back, and then it gets only 3-4 hours sleep a night. So you can have an instant solution, or you should, what do you think?
I wish I did. The first thing is he getting up very tired?
Yeah, he's getting up tired.
So he's getting up very tired means that there is definitely sleep deprivation. And one is we need to ask him how your mood is. Is there a lot of things happening in your life? We need to check about that. And if there isn't, then I would definitely advise him to go see a doctor to see if there's any physiological reasons as to why. But if it's emotional, then I would highly suggest that he come in and see a psychologist.
So is there cognitive behavioral therapy for this?
Yes.
What is that?
So with sleep it isn't, but what the therapy you're talking about is called cognitive behavioral CBT. But there are various other therapeutic ways of working on it.
No, I'm asking this question because I see a lot of people, not directly related to gas, but they come and say that there's no snoring, there's no obstruction, they do all this, but they're not able to get to sleep for some reason. Some thoughts keep coming.
Exactly.
So would CBT be useful for this patient?
Yes, it would be.
What would you do in CBT normally?
So cognitive behavior, so as the word suggests, cognitive meaning the way you think, and the behavior, what behaviors you're doing, because the way we think affects the way we behave, which affects the way we feel, and they're all interchangeable. So in CBT, we're really wondering how, okay, what is the thought pattern? Are you a worrier? Are you generally a worrier? If you are generally a worrier, then you are thinking about certain things and there would be some stress events in their life that is keeping them up that way, right? And normally, if your worry keeps on, that means you haven't found a solution or you think a problem needs to be solved then and there. And
but it's easy to tell somebody stop worrying, but they can't.
No, it doesn't work that way.
Yeah.
It really doesn't work that way. So, that's the beauty about our thought. We don't have any control about our thought. A thought comes, and it's not the thought, it's what we do with the thought. It's what how we translate the thought. We have thousands of thoughts all at once, all going up. But why do we pick those ones? Because these ones we pick in our mind are related to something we have a fear about. And then we start to ruminate. The problem with the way we think is that we can start to ruminate and obsessively think, which turns it into an anxiety. It can turn it into an anxiety disorder. And OCD, very, very, very common.
Yeah.
If it's not treated very well, there's a high chance that anxiety can lead to OCD. And sleep. There's a lot of people that I've met who've come into the clinic who are very worried about their sleep. Now, I do want to say one thing. People who have, gadgets on their hands, they have a preoccupation with thinking about how much their sleep.
Yeah.
It's not good. So it's good to gauge, but it isn't good if you start to worry about how you are sleeping, and then it becomes obsessive.
Yeah.
It starts to come into the way you're thinking about it. I haven't slept well today. Oh yeah, I'm feeling tired. I'm feeling like I can't think. I'm more irritable. Like it's all like very suggestive as well. Yeah. So this is also a big issue. So if the person is waking up everything, the first thing is asking him, do you have a lot that you're worried about, and is this a pattern, and how long have you been going through this?
So Praveen, I hope you got some of the messages. Hopefully what you require is, I think, a cognitive behavioral therapy, which will to some extent solve. In fact, recently all of us seen in news about a device called Neurolink, which Elon Musk is sort of pioneering, where patients who have a paralytic stroke can have this put in the brain, and then they can lift their hands and legs and so on. I'm hoping that you come up with a Neurolink for sleep. You can switch it on and switch it off, and then you can sleep when you want to.
That
Hopefully,
would be great.
I think that's a very important civilizational issue that we'll be solving once you have
Absolutely.
this. But Dr. Narasimhan, of course, you've got a huge knowledge, general knowledge of medicine also. A lot of people start taking melatonin. They feel that that's more physiological way of sleeping. What is your opinion on that?
So, like any physiological loop, temporarily it will work. When the exogenous melatonin goes to a particular level, the endogenous melatonin goes down. So one of the common things which sets up the melatonin is seeing the early morning sunlight.
Yeah.
If you see the early morning sunlight, the brain knows that it has to shut down the melatonin production, and it starts, the circadian rhythm starts there. That's why the birds, even though at 4 a.m., they know when to wake up and go. And 12 or 14 hours later, gradually there is a buildup of natural melatonin and the sleep occurs. When a person wakes up at 9 a.m. in the morning and sees the sunlight for the first time, the whole cycle is moved by 4 hours. So he's not going to sleep at 10 o'clock or 11 o'clock. He'll fall asleep at 1 a.m. So one way to correct this problem is at least have a brief exposure to early morning sunlight. Briefly, melatonin is okay for jet lag or something when you're again the time zone. But chronically, if you're forced to use, you need to go back and check why this is a problem. Is it thyroid? Is it restless leg syndrome? Is there something else which is causing? You need to see a physician or a psychologist, as the case may be.
No, that's very, very interesting. So don't use melatonin normally.
Long term, no.
Only for jet lag or things like
Yeah,
that. Very
short
short
term.
periods you can use. So, Anvish, coming to this, do pilots use melatonin commonly? I've heard a rumor that they use this. What happens is you're in a very stressful flight, you get down. It's very difficult in a foreign surrounding. Many of us, if we sleep in the same bed, we go to sleep. But if you go maybe north, south, I don't know, and those things make a difference. But you go to another place, you're trying to sleep, you don't fall asleep. And every day you're sleeping in another place. Yeah. So how do you cope up with that? Do you take some melatonin or anything like that?
The time zone is definitely a concern, sir. Melatonin, I mean, a lot of pilots take it, but it's off the record. I mean, it's maybe lack of awareness. The consequences of taking melatonin for long term, not many people are aware.
Yeah.
So it's just like, over-the-counter drug, people take it and then it gives them the sleep. So that's a short-term benefit what they look into it. So as you said, most of our flights, so we don't sleep in the same city or the same hotel most of the time. So that's actually a concern because when we wake up in the night or typically for the washroom or whatever, the physical activity or where to go. Out of the muscle memory, we usually go in the house without even completely waking up. But in the hotel, we had to wake up, and once we wake up, it's gone. I mean, you just can't sleep so easily. So the best remedy for that would be, I think, work out about 2-3 hours before the bed.
So so that gets us to the question of physical workout and sleep. What is the relationship between that? You want to take this up?
So it's very, very important to have not only actually, a lot of people concentrate, I have to work out 45 minutes. It isn't that. It's not only the 45 minutes that you do working out, it's how you physically move your body throughout the day, which is very, very important. And so if you have, I was saying earlier, that if you can get your sleep patterns in order, and like you were saying, the circadian rhythm, your sleep hygiene, your brain picks up the cues when it needs to switch off. And before it switches off, you have to have what I call as an unwinding exercise, where whatever you're worried about, you can write it down, and always remember, whatever you're worried about in the night, it's going to be there in the morning. The same worries are going to be there. So might as well park it and sleep. So the more you concentrate on having cues on how to respond to your worry and what to do to unwind, and the more you set the tone for your body to sleep, the better it is. Then in the morning, when you get up, it's very important, like sunlight, 15 minutes of moving your body, exercising, pulling your muscles up. And then the next thing is what we call is winding up, which is think about what your day looks like and prepping the day and saying, okay, I have this day today. You're not like running out the door, not being able to catch a minute to just think, my day. Look at your calendar, say, okay, I've got this meeting now and this, and plan your day. The more you're able to mentally think that you have your day sorted out, you have your sleep. Physically, you take little breaks, every 2 hours, go walk around your office. You can walk anywhere, take 2 flights of stairs. Small things can make a huge difference. And if you do this and keep your body moving throughout the day, you're more likely to be physically tired, mentally tired, and have a good night's sleep at the end of the day.
So that gets us question about, a lot of people ask me this question also, maybe exercise, they say, should we do a morning exercise, should we do a night exercise? What is better for sleep?
So there are certain exercises which perks up a person. For example, running, jogging, everything, they perk up a person. Stretching exercises, warm shower, swimming, those are all relaxing exercises where the gamma neurons kind of relax, the muscle tone comes down and they go to sleep. So it depends on what type of a thing. You choose some of the stretching exercises in the evening, like yoga, swimming, sauna, those kind of exercises in the evening. and ask them to go for a brisk walk, run, or hit the gym in the morning. Those are completely two different types of exercise.
Oh, that's a very good point. So, based on the type of exercise, you can decide when that should be done. So, that's a very important point. And Srinivas, I think you are the president. You were the president of Sleep Society. Why is it that there's so much lack of knowledge among even doctors about normal sleep, altered sleep, testings, and all that? What is the reason?
See, I think, sir, first of all, if you look at any of our curriculum, whether whatever, right from our MBBS time to our master's time, actually there is nothing dedicated to the science of sleep. I mean, yet, sleep apnea, sleep-related problems are enormous. They are glaring at us. Every single disease you look at, it has a sleep connection to it. So the basic problem starts from there, because we are not even sensitized to the concept that sleep is important, and sleep plays a very important role in the manifestation of various diseases. So even if we, since it's not there in our curriculum, obviously it is not taught. Since it's not taught, it's not given in the exams, and most of us are not given any, once it comes in the exams, it becomes important. If it doesn't come in the exam, you're not going to take it seriously. And then obviously out of sheer ignorance, a lot of these things are missed because of lack of sensitization. And the same thing is percolating into the society as well, because the doctors are coming from that society. And the society, ours is a society where of Kumbhakarna, where when you sleep, he probably has some kind of a REM behavior disorder or something that he couldn't be even woken up with trumpets and all that. So ours is a culture coming from Kumbhakarna. So people think that sleeping well or sleeping with a good snore is healthy, which is actually the opposite of that. So I think it's all upon us as professionals, as people who are associated with sleep, to sensitize the general public that sleep is a necessity, it's not a luxury, and everybody needs to get that much amount of sleep. In fact, earlier Anvesh was talking about the circadian loop. Actually, that correlates to the REM sleep. Now, we were also talking about REM sleep and non-REM sleep. In the initial phase of sleep, it is predominated by non-REM sleep. Deep sleep, which your watches or your computers call it deep sleep, is deep non-REM sleep. Now, in the early hours of the day, which you're talking about from 2 o'clock to 4 o'clock, 5 o'clock, is dominated by REM sleep. But that is when your brain is getting consolidated, your memories are getting consolidated, your learning is consolidated. So if you are deprived of that part of sleep, and the next day the brain doesn't say thank you very much and it doesn't do a rebound, it doesn't. So you have lost that part forever. So it's very important that you have equal amounts of these two sleeps in a very balanced way, so that your learning, your abilities, your memory gets consolidated.
So progressive sleep imbalance could lead to dementia?
Yes,
yes.
So what happens is, again, like how we have a lymphatic system in the body, which cleanses the entire the bad toxins from our body, the brain has something called the glymphatic system. So glymphatic system gets activated in certain stages of deep sleep. Now, if that deep sleep is deprived, the glymphatic system cannot clear off the certain fact that we call that the tau proteins, and these are the ones that cause Alzheimer's. So if the glymphatic system cannot cleanse the brain, all the toxins get remained, and there has been a clear-cut association that is being shown with sleep deprivation for whatever reason and early onset Alzheimer's disease.
So that's a very important point. So that's also very important why sleep is required.
Very
Adequate. And there's another question that also people keep asking, and again, Vishwanath, this maybe Narasimha also could take this up. They say, okay, you say 7 or say 8 hours of sleep, but I'm sleeping for 2 hours in the afternoon, is 6 hours in the evening. So they sort of do a mathematical calculation. What is your opinion on that?
So I think, like everything else, we forget there is a range, physiological range. So if a person has been from childhood used to 6 hours of sleep and then wakes up refreshed, that is his requirement.
Okay.
The end point is, are you waking up very refreshed and you're functional? And the requirement varies from person to person depending on their day-to-day activities, so on and so forth.
So you feel the range is there?
There is a
and
range.
What about afternoon sleep? Do you think people should take this or not take this, or what is your opinion on this?
Afternoon naps are good actually, but if it's not crossing more than 30 minutes.
Oh, 30 minutes, that's
30
good,
minutes,
yeah.
20 to 30 minutes is the ideal period of a nap actually. If you sleep beyond that, as was pointed out earlier also, it impairs our efficiency. And also you asked about this important question of 6 plus 2 hours actually.
Yeah.
Dr. Srinivas Kishore earlier mentioned that in the later phases of the sleep, you get this REM sleep. So when you're sleeping for 8 hours at a time, your amount of REM sleep, what you get, will not be equal to what you sleep as 6 plus 2 hours.
Right.
Oh.
So your REM sleep is the sleep where you get rested well actually. So you need to sleep at a stretch actually for 7, 6 hours or 8 hours depending upon what is important for you. And then the afternoon nap can be half an hour also. It cannot be 6 plus 2.
So it's better to have a very short nap even if you have.
Short nap
And
the night
REM sleep would be, is there any devices which actually tell us how much REM sleep you had? All these variable devices.
Yes,
do
all
they
the
differ?
variables will tell you, but they are all surrogate measures. They are not recording with your EEG.
Yeah.
So they are all using some kind of algorithm to pick it up, which are not really accurate. And that actually brings us to that anxiety factor.
Yeah.
Oh, I have not had deep sleep enough. I have not had enough
Yeah.
REM sleep. We have patients coming and saying, sir, I'm feeling very tired. And then we dig a little deep. Says, where is the root cause for all this worry? It's all his watch. It's basically the watch has
Yeah.
given you that thing that this week you have only slept for a few hours,
Yes.
and that anxiety is kicking in.
So you would not recommend this very strongly for people?
Not very strongly.
Put on all these devices because it's become a fashion. Any IT person coming to us here in the hospital has a variable device
Right.
tracking sleep and all that.
As long as it's not affecting him, that's fine. But if it's causing an anxiety, that itself is causing more problems than it's supposed to help you. So.
Could I ask one thing? Don't you feel that there's so much preoccupation with our health and our lifestyle and wellness that we're creating this environment that is forcing, or all of us have to eat right, we have to sleep right, we have to think right, we have to behave right. Like there's so much of that emphasis that I think we are creating that obsessive need.
spontaneity is
and
gone.
it's gone. And so I see that more and more, and you're all nodding your head, so I'm sensing that you agree with what I've been seeing with clients, which is that there's so much of preoccupation with we don't allow ourselves to know that trust your body. Your body knows sometimes what to do, when to sleep. Take the cues from your body, and it will tell you. At least that's what I kind of see that we need to go back to.
Nature.
Helping. Yeah.
Nature, yeah. So I think that the point that Narasimham emphasized on daylight and going back to nature is a very important
Yes.
part of that. We've gone away from that. Yeah.
Yes.
And I think Vishwanath is an expert in yogi nidra. You want to tell us something about? So there are a lot of people who come and say, I can't sleep, no other problem. So I talk about this. So you have any suggestions about that? What exactly?
So,
should be done?
this is a very important thing for people who are not able to sleep. This is popularly called as yoga nidra or non-sleep deep relaxation. Earlier, Dr. Varudni mentioned that some people are too much worried that they are not able to fall asleep easily. In such kind of patients, you advise this yoga nidra. In this, what you do is you have a guided relaxation technique in which you take your attention either from the head to toe or toe to head, covering each and every body part actually. In that time actually what happens is you are turning your attention from outside thoughts or the worries to your body parts actually. Most of the times just gently shifting your attention one body part to other parts. In the process you fall asleep. Most of these techniques range somewhere between 15 to 20 minutes actually. There are some short videos of 8 to 10 minutes as well. Depending upon each person's need, they can try it. And there has been lot of scientific research which has been done on this yoga nidra, and we have some studies from Lucknow where they have shown that people who have insomnia, when they use this technique of yoga nidra, they sleep well. And people who are driving constantly, they have used it in lorry drivers and found that the accidents incidence has reduced when they used it in drivers who were driving between Lucknow to Delhi actually, in that highway. So the accidents, so each of these drivers were just stopped, asked to take a small guided meditation or yoga nidra sort of things, where it has reduced the incidence of accidents in that trial period actually. And also it's also very good for people who have chronic pains, like autoimmune conditions, who have this arthritis, anxiety, lot of other conditions. And it was also shown to modulate the rhythm disturbances in people who have ectopics and everything, who have sleep deprivation. That also helps. It's almost a 15-minute session is as good as having an 1 or 1.5 hour of sleep actually.
Oh, that's very interesting. I think this is something that, is there any way people can learn this?
So there are guided videos in the YouTube actually. Some of them are very, very popular and also available in different languages actually. So if you just type yoga nidra or non-sleep deep relaxation, it's also called NSDR. It's also practiced by a lot of CEOs of Google, Microsoft, all these people. In fact, they discuss in their company meetings actually to make them feel relaxed actually. The employees relaxed.
Yeah, that's good information. And Srinivas, this lot of people again come and tell us they do some oil pulling or put some saline. Clean. Does that help or what?
So this comes from the notion that nose is blocked, and blocking of the nose is causing snoring and sleep apnea. Even though there is certain amount of truth to it, but most of it is not, because the snoring or sleep apnea is not because of the nose, or neither does it develop at the level of the nose. However, nose is the preferred way to breathe. Hence, we would like to keep our nose open. So by doing these things, they try to increase, or by putting oil in the nose, they sort of try to reduce the surface tension so that the air sort of goes in easily. Even though temporarily it gives them the relief, there is rebound congestion in the nose which happens a little after. So this rebound congestion later evens out the nasal resistance. So even though temporarily they feel good, in the long run, this doesn't really come out in the form of improved outcomes as far as nasal block. In fact, better than that is normal saline, our age-old Jalniti, our nasal wash, which most of the yoga kriyas sort of explain. This is and this is now commercially available. We call it naso washes, and these nasal washes help to clean the nose. It also changes the nose, reducing the bacterial load and viral load, and hence this would be any day better than putting oil or ghee in the nose.
Yeah, so also we are starting to get a lot of questions. I don't think we can take them up because nearly time up, but one question coming from Siddharth Nani says that he's 25 years old, he's facing sleep issues for past 4 years. Brain is not ready to sleep. He says he doesn't have any sleep apnea or any other medical problems, but it's just that he's lying down in bed, he's not able to sleep at all. There's no interrupted sleep also.
He has insomnia.
So,
Yeah, he has insomnia.
so this is insomnia.
Yeah.
It's insomnia.
And what do you think would be the remedy for this?
Well, again, come back. We need to talk a little bit more,
Yeah.
find out what the pattern is,
So I think
how
Siddharth,
long.
I hope you're listening. I think this is a
Yeah.
problem which is not serious, but you'll have to consult.
But I do
psychologist, yeah.
say one thing, that sometimes insomnia also happens when they've gone through a period, maybe a year or
Stress.
two, a huge
Oh,
stressor event,
Yeah.
and then they haven't been able to reconnect and go back to a form of rhythmic lifestyle,
okay.
and then insomnia can
So it could be
start.
precipitated. I think after COVID, we are seeing a lot
Yes,
of people
yes. Oh,
who are
huge.
not able to sleep after the COVID.
Yes, I think
pandemic.
COVID, what happened was it gave a chance for everyone to abuse or think that they can be up at night and work whenever they want. They removed the discipline regarding sleep, eating, everything was upside down, and that has created a huge impact, because parents, children, everybody's sleep hygiene was affected during COVID.
So I think, yeah.
A couple of important things which can be done for this insomnia are
Yeah.
avoiding caffeine in the late evening,
Yeah.
following a regular sleep hygiene.
So after
like
6, no coffee.
no
Yeah.
no coffee,
Okay.
and then trying to sleep at a regular time at same time as far as
Every day.
possible, and then also this yoga nidra can also help.
Yeah.
Yeah.
In addition to tackling all these worries and other things, these are some simple things which can be
In
done.
fact, yeah, sorry.
No,
go
no,
ahead.
go.
So, the biggest problem here is, in fact, if you look at all the sleep disorders, the commonest sleep disorder is insomnia,
Yeah.
followed by sleep apnea. And unfortunately, they sometimes both come together. And that is called COMISA, that is comorbid insomnia with sleep apnea. The reason why that is important is because any of the treatment remedies that we offer to sleep apnea, it becomes impossible for that patient to take it because of this comorbid condition. So I think this is a clear-cut multidisciplinary kind of a treatment that has to be offered. And every year, this incidence of COMISA is just rising.
That's very important point. I think we're getting out of time now. We just have 60 seconds left. I'd like to thank all our panelists for such excellent discussion. We at AIG Hospitals are very aware of the sleep problem. I think this is something that is generally neglected. In fact, we have a large sleep clinic with multi-clinical type of approach where different specialties come in and solve your sleep problem. And we learn now from this discussion that there's a wide range of sleep problem, right from insomnia to sleep apneas to comorbid conditions like Srinivas just described. All of these problems can have very deleterious effect on health, like right from the heart, irregular heartbeats, sudden deaths, lungs, the gastrointestinal tract. You can develop fatty liver, indigestions, and all sorts of things. And also, it can affect your functioning, and in a vital situation like pilots, it can affect a pilot functioning, or even a critical operation is being done. If the doctor hasn't slept well the previous night, it can be very critical. So I think these are very important messages, that we know that wide range of sleep disorders, that all this can affect our every part of the body, and more importantly, we now have the ability to actually test to see what level of abnormality. Is it because of an anxiety and so on that's coming, or is it because of actual obstruction to the pathway, the so-called sleep apnea, which we commonly see. We have very sophisticated sleep labs now which can test all these things, and some of these can be mechanically remedied, like we discussed about the surgery, putting electrodes so that your tongue doesn't fall back. So variety of very sophisticated tests are also available. And for true insomnia and other problems, we have the CBT, the cognitive behavior therapies that are coming in. And of course, we have this yoga nidra and a lot of other things. I think sleep is a very important subject that's often neglected. We now have seen from this discussion that can have a very wide spectrum, and hopefully we hope that people who are watching this have been educated to some extent, and we wish to continue on this topic as we're starting to get a lot of questions and queries. Maybe we can do a much larger, more specific symposiums in future. Thank you very much.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.